Swadikap, good afternoon once again. Thursday, the 20th of May, 2021, and this is the English language summary of the daily press briefing here at the Center for COVID Situation Administration, or CCSA. I'll start off first with the numbers and statistics for today. Today, we have recorded 2,636 cases. Out of this number, 2,578 are from local transmission, so the majority remains from local transmission. We have from overseas coming into our quarantine system, 58 out of this number. This is actually a new high for infected persons coming from overseas, but rest assured they have been entered into our quarantine system as usual. And of the number of local transmission, this also includes 671 who were detected in prisons. Currently, right now, we have active cases still being treated, standing at 42,246, as you see in the green box on top there in the infographic shown on screen. New recoveries continue to be high at 2,268 as compared to the new confirmed cases, 2,636. Unfortunately, 25 new fatalities for today, making the cumulative fatalities in Thailand at 703. The 25 fatalities, we have 11 of them coming from Bangkok. Pathum Thani reported 3 fatalities of this number. Chiang Mai reported 2, and 9 other provinces reported 1 fatality each. In terms of the observation, the daily CCSA meeting this morning reviewed the risk factors for local transmission of confirmed cases for today. In particular, it continues to include market stalls and vendors in markets who are in close proximity to each other, and workers' accommodation in nearby marketplaces. The meeting this morning also gave importance to improving the hygiene and ventilation in markets, as well as measures to reduce crowded spaces within markets. Regarding the situation in prisons, while the number continues to come from prisons, a certain number continues to come daily from prisons, it is actually decreasing with 671 cases reported today. One issue I'd like to inform the English language audience here is to address the risk and worry of the spread of the virus in prisons. His Majesty the King graciously donated a digital portable X-ray device with artificial intelligence AI systems through the royal project called Correctional Program Sharing Happiness to Chiang Mai Central Prison. His Majesty initiated this project with the aim of improving the well-being and health of inmates in prisons, as well as to provide equal access to medical care to support in that endeavor. And as mentioned in previous day, Thailand continues to prioritize public health, safety, and accessibility to healthcare services for everyone residing in Thailand, including, of course, in prisons. And of course, as we mentioned quite often, no one is safe until everyone is safe. For Bangkok, as for the recent outbreak, it's still ongoing in Bangkok. The Metropolitan Administration, BMA, Bangkok, has implemented 3 major health measures to prevent further outbreak in wider communities. Firstly, active case finding measures in major clusters and nearby areas continue. Secondly, personal hygiene measures, such as encouraging people to wear masks and strictly observe social distancing, as well as closing certain public spaces as deemed necessary. So this is on the part of Bangkok, BMA. Thirdly, other organizational measures, such as seeking cooperation from construction camp owners and market operators to enforce DMHTT. In addition, the Department of Disease Control, or DDC, will allocate more vaccines to Bangkok Metropolitan Administration as part of the effort to achieve the goal, as you have heard by now, 70% of Bangkok's population to be inoculated within the next 2 months. In Bangkok as well, as BMA continues to ensure sufficient hospital beds. Yesterday, we had the opening of the 6th field hospital, which is the Ratchapipat 2 field hospital, located inside a temple, Wat Sri Sudaram Waravihan in Bangkok Noi. And this field hospital can accommodate 200 patients. You have some visuals there on screen for you. 200 patients who are either asymptomatic or exhibit mild symptoms. So this will go a long way in helping in terms of the supply of beds, especially for those with mild or moderate symptoms. This will enable hospitals to have more beds available for the more serious conditions. Also, moving on to the provinces, the Civil Aviation Authority of Thailand recently announced that travelers who wish to board flights to Phuket must present a vaccine certificate or a negative COVID PCR test result or rapid antigen test result conducted within 72 hours upon arrival. Otherwise, they will be denied boarding. This is for domestic travel, effective from the 19th of May, 2021 until further notice. For the foreign community here, just one piece of information that might be useful if you're traveling outside Thailand is that Japan has barred the entry of foreign travelers from many countries, including Thailand. So just as an additional update for the travel restrictions today, you may have seen this on the news, the Japanese government will barring the entry of all foreign travelers who have visited Thailand from tomorrow, the 21st of May 2021 onwards. Foreign travelers who visited Thailand within 14 days will not be allowed to enter Japan, except under special circumstances. And Japanese nationals returning are exempted from this measure, of course. But of course, Thailand is one country. In terms of the newest release, Thailand is one among the 7 countries that have been barred. And in the total number of countries, it's around almost every country, 160 countries. So Thailand is part of that group, of that list. It's not meaning that Thailand is the only country or there's only a few countries. They have barred actually almost all countries for temporary banning for travel into Japan during this time. Moving on to update on vaccination. Yesterday, we administered in one day, just yesterday, 94,000 doses of vaccine. Cumulative number of doses up to the 19th of May is more than 2.54 million doses now. And of this number, more than 1.64 million are first doses, and more than 890,000 are the second doses. Just a note, as mentioned by Dr. Thuisin, the importance that we give to the foreign migrant labor community as well. So there are around 1.3 million legal migrant labor in Thailand, and perhaps 1 million plus more of illegal migrant labor in Thailand. The Ministry of Labor is working on this issue to possibly inoculate this important group of migrant labor in Thailand, as they are a group with high mobility. And of course, the legal and illegal migrant labor would be meeting and mixing with each other. So in order to avoid the spread of COVID, the Ministry of Labor will be focusing on this group in terms of the inoculation, the vaccine plan. Now, very important, a special meeting will be convened this afternoon. There were actually a couple of meetings yesterday already in the outset. And now this afternoon, there will be a high-level meeting to discuss the vaccination plan for different groups. So the CCSA hopes to provide you with an update on these finalized measures in the daily press briefing tomorrow. So please stay tuned for all different groups, including all different groups of foreign nationals. As you would know, there are many, many groups: migrant labor, expats, retirees, students, and the like. So please be patient, and we'll provide you with the results of this afternoon's meeting tomorrow. So as always, we have another WHO infographic, this one on how to keep yourself safe when shopping at markets by ensuring that your hands are clean and keeping physical distance at least 1 meter from each other. So thank you very much for your attention and we'll see you again tomorrow with important information สวัสดีครับ
กราบขอบพระคุณค่ะท่านณัฐพานุ นพคุณรองอธิบดีกรมสารนิเทศและรองโฆษกกระทรวงการต่างประเทศนะคะ